The Center for Molecular Fingerprinting is an interdisciplinary nonprofit research institution. The international team of medical doctors, nurses, laser scientists, molecular biologists, engineers, and data analysts is driven by a common goal: moving the frontiers of monitoring and probing human health. CMF pursues the development, testing, and validation of laser molecular fingerprinting for next-generation blood-based diagnostics with large-scale clinical samplings. This happens in cooperation with major healthcare institutions in Hungary and abroad. CMF's vision is to create a reliable, cost-effective, high-throughput approach for populational health monitoring and early disease detection at molecular levels, even before symptoms appear. This research could make the current healthcare system more effective and improve the quality of preventative medicine with the possibility of safeguarding our health in the future. What is preventative medicine? How could the research at CMF contribute to it?
Preventive medicine aims to prevent diseases and health conditions before they occur. This field plays a critical role in improving public health, reducing healthcare costs, and enhancing the quality of life. Preventive medicine involves identifying and addressing factors and individuals at risk of developing certain conditions. Such states are intermediate ones that may lead up to the development of a disease or condition, so-called health to disease transitory state. Importantly, to maintain people in good health, it is imperative to first understand what it means to be healthy at molecular and systemic level. It's challenging to understand and catch such transitory preclinical states if we do not understand the palette of health states, especially given that each of us is different. Therefore, health must be assessed in a person-specific manner. Regular screenings are the key component of preventive medicine. Yet these are often too complex and costly for broad population-wide screening. At CMF, we are pioneering a new tool to monitor human health in a minimally invasive fashion. A blood plasma-based analytical test as a new gateway to quantitatively assess our health and capture its deviations in a screening mode. To this end, we employ infrared molecular spectroscopy as a new means to profile blood plasma. The measured fingerprint information provides us with quantitative molecular characterization of molecular makeup of plasma.
Why is infrared molecular fingerprinting a promising candidate for contributing to the establishment of comprehensive health monitoring?
Hundreds of thousands of blood plasma molecules carry unexplored information about our health. We correlate measured plasma-based infrared molecular fingerprints with medical information of the same individuals and basically follow these individuals and their possible health changes over the years, or to develop a rapid medical screening test to characterize human health and its changes over time. The approach we chose is promising, as it requires only a small amount of blood to be sampled, a procedure that's common to medical practice. In addition to being minimally invasive, the plasma measurements are on the minute scale, and the medical test facilitates analysis of multi-omic cross-molecular infrared fingerprint, meaning that we obtain quantitative molecular landscape of plasma makeup across different molecular groups within a single measurement. Importantly, the single measurement test further brings cost effectiveness and the possibility of laboratory-based diagnostics in realistic medical scenarios, facilitating population-based screening. Given all these advantages, along with obtained results and understanding, we will already gain robustness, stability. We can use advances in laser science to shape a new, medically helpful tool for the future of health probing.
What is the basic concept underlying EMF, and what is the role of machine learning in its utilization for disease detection and health monitoring?
An ultra-short infrared pulse hitting a molecular sample excites resonant vibrations that still last after the pulse is over. The process is similar to striking a tuning fork. The tuning fork vibrates at frequencies defined by material and geometry. In a molecule being hit by a laser pulse, atoms vibrate around their equilibrium positions at frequencies determined by the atomic composition and structure of the molecule. Each molecule has its own set of atomic resonators, tuned to a characteristic set of frequencies in the infrared spectral range. The vibrating molecules emit infrared waves at their resonance frequencies, and we can capture the electric field of these waves with the help of another ultra-brief laser pulse. This yields the electric field molecular fingerprint of the sample. The technology is still in its infancy, subject to advancement on several fronts. The more powerful and less noisy the excitation, and the more sensitive the detection, the more molecular information can be captured by the signal.
And the more information it delivers about early disease onset. How early depends also critically on the choice of the references against which disease-induced deviations in the molecular signal is to be observed. The task of machine learning is to capture a robust deviation from noise, ideally exceeding the biological variation of references. This is essential for the early stage detection of diseases and accurate health monitoring. Machine learning algorithms excel at handling large and complex datasets, identifying subtle patterns and adapting to changing conditions over time. As a result, they could empower EMF technology to not only provide a snapshot of an individual's health, but also to predict disease onset, track progression, and personalize treatment strategies. By utilizing an individual's historical EMF data, machine learning models can account for the unique molecular profile, overcoming interpersonal biological variability and providing a more precise assessment of their health status. With ongoing advancements in both EMF and machine learning, the potential for revolutionizing disease detection and healthcare is significant, promising more precise diagnosis and improved outcomes for individuals.
Why is a large-scale longitudinal study required to validate EMF or any other set of biomarkers for health monitoring?
The efficacy of a biomarker depends on the magnitude of its disease-induced change and, equally importantly, on its biological variability in the samples used as a reference. Just as increased response to the disease, reduced biological variability of references leads to improved classification. Infrared fingerprints of blood plasma are extremely stable over time for healthy individuals. Within-person variations are found almost 3 times less than between-person variations. If a test fingerprint could be referenced to a set of control fingerprints collected from the same person before contracting the condition, the reduced spread of the controls, that is, a narrowed baseline, should facilitate the detection of the condition at an early stage, when biomarker response is weak. This may apply to several conditions. This hypothesis can only be verified by a large-scale longitudinal follow-up study. Following up with individuals is a must for establishing their personal baseline. If narrowed as compared to the populational reference range, it implies improved early detection. Why large scale? To allow some of the most prevalent severe non-communicable diseases to appear in a statistically significant number over the observation period.
What might be the impact of CMF, if successful, for the future of healthcare?
In one sentence, the transformation of healthcare to a dominantly preventive mode of operation. from its current, mainly reactive mode. How could this work? Yearly, every person provides a sample of their blood. After its EMF analysis and a comparison against a library of characteristic EMF patterns of diseases, the attending physician receives a report that might flag the early trace of a condition. Building this library is an increasingly rewarding effort. Each measurement contributes to a database of the temporal progression of individuals' fingerprints. These trajectories are annotated with deep health state data, such as clinical chemistry, medical tests or omics data, and covariates such as age, sex, BMI, physical activity, diet, etc., allowing a computational algorithm to ever more reliably predict a healthy person's upcoming fingerprint based on the covariate-adjusted trajectory of healthy aging. It is the significant deviation from this trajectory in individuals who are clinically diagnosed with a disease that allows to establish a catalog of differential fingerprint patterns for health-disease transitions. The algorithm trained with this ever-expanding library of baseline trajectories and significant deviations, including associated phenotyping data, will permit an ever more reliable de novo assessment of a person's present health state, improve disease risk prediction models, and enable the earliest possible medical interventions.